Hello, everyone, and welcome to the Power of Your Health. I'm your host, Dr. Freeman, and I'm so excited that you're joining us again. Whether you're listening or watching, we are excited to have a very special guest on our show today. He is a general surgeon, very proficient in his field. He graduated from Tennessee State, Meharry Medical College, and has his MBA from Kelley School of Business. So I'm sitting here with the one and only Dr. Reuben Rutland. I'm excited. He's here today on this episode to talk about trauma and nutrition. That's right. With everything going on in the world today, gun violence, people losing their lives, we need to bring awareness of how nutrition really can affect trauma and how it is associated with that. So let us welcome our very special guest today, Dr. Rutland. Thank you for joining us.
Thank you.
We're so excited
Thank
to
you for
have
having
you.
me.
And I know you're on call.
Right.
So let's get into it.
All right.
And I'm so excited that you are here in the community making such a difference.
Mm-hmm.
And I participated in your rally.
Right.
We call it a protest?
Right.
A peaceful protest.
Right,
Here on the lawns of Methodist Hospital. We are shooting live here in Gary, Indiana, I will say.
And thank you for coming out, too. Thank you.
I was not going to miss it. I had my sign ready. I wrote white coats for Black Lives.
Mm-hmm.
And it was amazing. I truly admire your work, your activism, everything you're doing to make our community a better, healthier community.
Thank you.
And this community really has a high incidence of trauma. Would you say?
Well, we have a fair incidence of trauma. We're about along the national norms. National norms for us is 70% blunt trauma, 30% penetrating. Penetrating is usually gunshot wounds, stab wounds, and like that. Mm-hmm. We have 4 highways going through the city. We have a steel mill, so we see a lot of blunt trauma as well.
That's incredible. That's incredible. So what do you say to our audience in terms of how nutrition and trauma are correlated? Is there a really big, significant difference in how we can stay healthy from a natural wellness perspective? How do we do that?
Well, one thing that you see, trauma areas are a lot of times in poor areas because that's where the trauma is. You know, poor areas are higher rate of gunshot wounds, stab wounds, and assaults. Trauma areas are in those areas because that's our patient population. What you also see in those areas is what's called healthy foods desert. One thing I was trying to do when I used to be the health commissioner is we tried to get a program here to start bringing some more fresh fruits, vegetables into the community. You can leave here and within 2 or 3 minutes you can be at several fast food restaurants. But how many places can you go to get actually a healthy meal quickly? You know, other places have restaurants that sells healthy salads that's convenient for people. You have people like Panera Bread that's a lot healthier. But when you come to our area, anywhere within walking distance and even driving distance around the area is a healthy food desert. You cannot get sustainable healthy food. Unfortunately, healthy food is more expensive, and so being poor, being without it makes that much more difficult for you to try to go and get healthy food. You have to leave the community. And many people don't have means to leave the community to come back just to get food. And what they do is, you know, they try to supplement a home-cooked meal with then fast food meals for so many other meals. And that's just a downward spiral that leads to diabetes, leads to, you know, obesity. I mean, obesity doesn't just lead to diabetes. There are other cancers that's associated with obesity and different things like that.
Yes, I mean, you mentioned so many crucial things, health disparities, food deserts.
Right.
That's one thing that I like about what you're doing. And even with Methodist Hospital, they have a farmer's market. I know there's Faith Farms. It's a community here that's growing food from the ground.
Right.
And unfortunately, access to good foods is a problem in this area.
Right.
How do you shop at Aldi's? You know, or any like other, you know, local market, we can still make it work. Find the fresh foods, the lettuce, the kale, the carrots, there's an increase in processed food, and plus it's cheap.
Yes.
It's easy and it's quick.
Yes.
Does that make us like sick? How
Well,
does the trauma and the nutrition does it make you more aggressive eating this type of foods, more moody and make?
You know, I think if you can, I can just tell for me personally when I try to eat healthy. So I usually, like today, I ate a chicken salad for lunch, or generally I eat healthy meals. But every once in a while, I do have that several days on call, get home late, don't feel like cooking, or your wife didn't cook, so I'll get fast food. Instantly, you can tell the difference in your behavior, your personality. You go from being full and energetic to being sluggish and lazy. Okay, so that may not have to do with the trauma point. The trauma point is just. It's just a poor area, and poor areas don't have access to that. And so what we have to do is we need to bring healthy foods into the community. Like I said, one thing we were trying to do at the health department was not only do you bring the healthy foods into the, I was talking to somebody who was over the farmer's market about a year ago, and they had some squash and different type of things, and people went over that and just went to the basics. They knew about the corn, the apples, and the fruit like that. Yes. So what you also have to do is put a program in place to say, let's teach people how to cook healthy foods.
Yes.
So one of the things we never got off the ground, but a big project of mine before I left the health department was let's bring cooking classes to the health department. I think that would be a good initiative. Good. So we say these are the healthy foods. Now, sometimes our people have a way of taking a healthy food, putting a lot of oil and cooking it.
We kill it.
We kill it. We kill it. Yeah. We take
grease.
Exactly. We take all the healthiness out of it.
It's dead.
But it tastes good. It tastes good. It tastes good.
If it ain't the grease, I know it's like what. It's just a taste you have to acquire, they say.
Exactly.
But it's so good. I'm living proof of it because, the thing about it, we have to, because the increase in diabetes, hypertension, obesity, you see it on an everyday basis.
Right. Cancer.
Yeah. Eating an alkaline diet makes a big difference because of the pH level. It does increase. Mm-hmm. Even with cancer, it's evidence that's really proven because when you eat more acidic foods, cancer cells live and thrive in those things.
Exactly.
In that environment. So,
exactly. And also glucose.
Glucose.
One thing I had to do research. One of the I had to present in front of the State House about 2 years ago. I was part of a group that was actually talking about bringing medical marijuana to Indiana. So I was speaking on that. But doing my research, one of the things that I realized, we were talking about difference in drugs between psychological dependency and the physical dependency. And sugar is an addictive drug that's in our community. And when sugar, as well as cotton, was one of the number one crops that kept blacks enslaved, because they had to bring more sugar, because the country got addicted to sugar. Yes. And so by doing that, they had to get more slaves down in Texas to kind of run through. So not going back to history, but it's just that it's here in our community. And you can just tell when you start decreasing the sugar in your diet how much healthier you feel.
Yes, sugar, it's a drug.
Yes.
It's a drug. I crave it, and I don't know, I'm like, oh gosh, because sugar really damages our body.
Right.
Not only diabetes, but physiologically, as a doctor, that the benefits, the downfall of eating sugar is more detrimental than salt.
Right.
Correct me if I'm wrong, but I believe that's true. How eating sugar makes your body weaker.
If it's not worse, it's up there with it.
Absolutely. All of those things. So we really have to have access to these fresh foods in communities that really need it. As you mentioned, the trauma points, we need that. It's not like that people do not want to eat healthy.
Right.
It's a matter of just having access to the food that's going to keep us healthy.
And if you're a single mom, or if you're a young couple working hard, come home with the kids, you don't have time to leave your community to go get a grocery, and the first thing you do, fast food.
Yeah.
And even, and then even when we do fast food, you have a salad at fast food and you chase it with a soda and some French fries. Or you have a salad and then you put so much salad dressing on it that now you just increase the sodium content of it, and you take something healthy and now you've made it unhealthy, which I do sometimes, but
yes. Oh, yes.
those are few and far between.
Are guilty of doing
those are few and far between.
Guilty of doing that. So when we have access to these foods, I believe people turn around their diagnosis. I've seen it.
Yes.
Have you seen that in your practice, how these diseases improve when there is improvement in the types of food we consume?
Right. So we have, on the general surgery side, not the trauma side,
Sure.
I've definitely seen when one of the first things when patient comes in have some type of abdominal distress or abdominal issues, especially if it's like the colon in nature, one of the first things you do is say you need to do a high fiber diet. One thing what comes to mind, I had a buddy who went to med school over in the Middle East. And one thing that Americans get that people over in the Middle East usually do not get is diverticulosis and diverticulitis. So for the people that's listening, diverticulosis is when you start to get like little outpouchings on your colon. And when they get infected, that's diverticulosis. When it gets infected, it becomes diverticulitis. And we see a lot of that. Actually, I think the last time I looked at the literature, 50% of the people 60 years old and older have it. And by the time you get like 80% in the United States, probably 100% has it. And it's really because as Americans, we have a lot of low fiber in our diets. We have starchy foods, and we don't eat a lot of fiber. So one of the guys when I met, a friend of mine that he was in med school overseas, he used to always say, when they're in med school, they get a pamphlet about diverticulitis. Over here, we have like a 1,002-volume book written on it because we have such a bad diet in the West. For us to be one of the richest countries, or what they say, first world countries, our diet is actually horrible. And one things that people can do, what we start doing with our kids, is fiber gummies.
Yes.
You get
Those
them.
are fun.
Yeah,
they taste good.
They do. The Metamucil cookies.
They're really good.
The Metamucil fiber cookies.
Yes.
I can't do the fiber kind,
Yeah,
but you do that, right?
Yes.
Yeah.
To even keep your children healthy
Right.
and to provide a better
Right.
outcome.
Right, and
their body.
you're not just doing it just for while they're kids, but if you get them in that role and to have a healthier diet, eat more fiber, you're protecting them when they get to like 40s, 50s, 60s, 70-year-old because they're less likely to have complications from diverticulosis that a lot of Americans have. Actually, it's such a big thing. It's a very big part of my practice. So if too many people do it, surgeons probably would have to decrease their practice in a couple of years.
Is that genetic, or is it something that is a combination of the foods
I think
eaten?
It may have a small point that's genetics, but it's really the decrease in fiber in the diet, because what ends up happening is this might sound boring to everybody, but the pressure inside your gut is too high, and when you have that pressure in a closed space, it makes outpouchings, little balloonings in your colon, and when they get infected, when you get blocked up, they get infected, and then that's when you need surgery.
The food sits in the pockets.
The food sits in the pocket, in the blocks.
It creates inflammation
and
pain, and there's no way it can get out type thing.
It's
lodged in
usually, I mean, most of the times you have to come to the hospital. Sometimes you can get away with just antibiotics, but a lot of times we have to go in and remove part of the colon. And if it's really bad, you get a temporary colostomy for about 12 weeks. If it's not so bad, but you catch it early, then you can kind of put them back together without having to go through the colostomy stage.
Very interesting.
Yeah. So just by starting some gummies, eating some Metamucil cookies, you could prevent this from happening to you, your family. I mean, our parents, it's probably too late for them, but you can always increase the fiber so they don't have more diverticuli to form.
This is getting so interesting. I love general surgeons. I tell you, general surgeons are amazing. You have to know everything in the body, right?
Yeah.
Everything. I just focus on the foot and ankle. Thank God. He does it all. We need you in our community. 3 things that our audience can take away of how to become better from a natural wellness standpoint.
Get rid of the processed foods in your kitchen. I know that's easier said than done, but start cooking with more fresh foods. One of the things that a lot of Europeans do, particularly from friends I had that was in Paris, we grocery shop, for the next 2 weeks. So a lot of times we buy food that's going to be stored for the next 2 weeks. A lot of them actually grocery shop every other day. So you're eating more fresh foods. You're eating food that you just bought yesterday. The other part I would say too would be increase the fiber in your diet, whether it's the Metamucil cookies, whether it's the fiber gummies, or any of the. I can't do the mixing because it doesn't taste good, but doing things like that will decrease the chance of colon cancer, decrease diverticular disease, and diverticulitis. And the other things I would just say, and this might not really a nutrition. This is what we need to do is. Get routine physical exams. I'm not going to be such a, because I don't do every year, but I'll be hitting 50 soon, so I'm gonna start doing it every year. But right now I do every 2 years. Yeah, you do every 2 years, and what you do, and the reason you do that is because if you find something small like a polyp in a colon, you find it early enough, you could just remove that polyp. The person can go on with life. It takes a polyp 10 years to go from a polyp to cancer. So if you wait after that 10 years, now you got a cancer. Now you got to have surgery. So I was just saying, be proactive with your health care and do preventive medicine.
Yes. Well, there you have it, firsthand from Dr. Rutland. Thank you so much. This was great. Please stay tuned for our next episode on trauma and exercise. Thanks for listening, and we'll see you at the next podcast.